returning to the United States who has been in Hubei province in the previous 14 days will be subject to up to 14 days of mandatory quarantine.
There are 7 confirmed cases in the U.S., including a woman in Chicago who passed the virus on to her husband. Now, one case is also a man in Washington state that we're monitoring.
And Oregon and Washington rather, health leaders in both of those states are closely monitoring the latest information about this virus. It's constantly changing every day. But we did speak with a local doctor who is an expert in respiratory illnesses.
And Lisa Balick shows us what we all need to know.
I think that we're worried about something because we don't know a lot about it.
Dr. David Hodgkin is a pulmonologist with the Oregon Clinic. He's an expert in diseases that affect the lungs. While Oregon has not yet had anybody with the coronavirus, there is a lot of worry it could show up here, whether it's from tourists, students, or business travelers to and from China. The symptoms are similar to a cold: a runny nose, headache, cough and fever, shortness of breath, chills, body aches. It's coughing and sneezing that spreads the virus.
The only individuals at this time in the United States that should be concerned that they may have this novel coronavirus are individuals that recently traveled to China or individuals that have been in contact with individuals who had been to China and had symptoms of a respiratory disease.
There is a test to identify it, but no vaccine to prevent it.
There's a virus here. We don't know how it's going to spread. We know that it's spreading across the world, but I wouldn't say that just because someone's traveled to China that you need to avoid them. I wouldn't say that anybody that is Chinese that you need to avoid them. We've heard reports in social media that individuals are trying to avoid individuals of Chinese heritage because they're worried that they could get the coronavirus, which is completely ridiculous.
Doctors say you are at much higher risk, though, of getting sick with the flu, which has killed more than 8,000 people in the U.S. this season, and it's not too late to get a flu shot. As for masks, the doctor says they don't really do much good keeping you protected from the virus.
That after you've worn a mask for about 15 to 30 minutes, it starts to become saturated with the condensation that you've exhaled, and once it's wet, viruses can move back and forth through it and it doesn't protect you anymore.